How do portal hypertension diet restrictions affect daily life? Living with portal hypertension means making some important changes to your daily eating habits. This condition often results from advanced liver diseases like cirrhosis or fibrosis, and managing it involves careful attention to diet. These restrictions can influence what you eat, how often you eat, and how you plan your meals, impacting your everyday routine. One of the main restrictions is on sodium, or salt. Because portal hypertension can cause fluid buildup in the abdomen, known as ascites, limiting salt intake helps control this. Most people are advised to keep their sodium below 2,000 milligrams a day. That means avoiding adding salt to food and steering clear of processed foods, which often contain hidden salt. While this helps reduce swelling, it can make meals taste less flavorful, sometimes leading to less appetite or difficulty eating enough calories. You might need to experiment with herbs and spices to keep your meals tasty without salt. Protein intake also needs careful management. Proteins are vital for keeping your muscles strong and preventing malnutrition, which is common in liver disease. However, too much protein can worsen hepatic encephalopathy, a brain condition caused by liver failure. The current approach is to avoid overly restricting protein for long periods, focusing instead on balanced sources like dairy, vegetables, and some grains. In rare cases of severe brain symptoms, temporary protein restriction might be necessary, but always under medical supervision. Eating smaller, more frequent meals is another key change. Instead of 3 large meals, you might need to eat every 2 to 4 hours. This helps prevent long fasting periods that can cause muscle loss and worsen liver function. Planning multiple snacks and meals throughout the day can be a challenge but is important for your health. Fluid intake may also be limited if you have severe ascites or low blood sodium. Drinking too much water can worsen swelling, so monitoring and adjusting fluid intake is essential. This can affect your thirst, but it's important to follow your doctor's guidance to avoid dehydration or increased fluid retention. Choosing nutrient-rich foods is also vital. Fruits, vegetables, whole grains, and low-fat dairy products provide essential vitamins and minerals like potassium, calcium, and magnesium. These nutrients support overall health and help regulate blood pressure in the liver. However, if you have kidney issues, some high-potassium foods might need to be limited, requiring personalized dietary advice. Avoiding alcohol is absolutely necessary because it worsens liver damage and can increase portal hypertension. Limiting saturated fats, processed sugars, and unhealthy fats also helps reduce strain on your liver and lowers cardiovascular risks. All these dietary restrictions mean you need to plan your meals carefully and sometimes work with a dietitian. It might change your social eating habits or make food preparation more complex, but these steps are crucial for managing your condition. They help prevent serious complications like variceal bleeding and support your overall well-being. Remember, every person's situation is unique, so always consult your healthcare provider for personalized advice. Following these guidelines can be challenging, but they play a vital role in maintaining liver health and reducing the risk of liver cancer.